You're listening to episode 110, a 12-minute talk with Dr. Jin Lee, a licensed clinical psychologist. Hello, my friends. I'm so happy that you're here today for a quick little episode that you can listen to on your drive to work or when you're walking the dog or whatever. And I'm going to be introducing you to Dr. Jin Lee today, who is a licensed clinical psychologist who has experience working in hospitals and is now doing her own private practice. And her specialty is with teens who have functional neurological disorders or post-concussion. And she just has so much information to give us, and she does it really succinctly in a short amount of time that I gave her. So let's get started so you can hear some great information and feedback from Dr. Jin Lee about how to support teens through chronic pain. Before we jump into the episode, I wanted to let you guys know that if you are a parent, a child life specialist, or professional working with children, you're going to want the hospital or physician's office or urgent care that you take your kids to have the Child Life On-Call app. It is an evidence-based tool designed to empower children and families during medical experiences. And 100% of the child life specialists who have used this app believe that it can help with expanding child life's reach beyond the bedside. And 100% of child life specialists believe it helps parents feel more empowered in their child's care. Learn how to get the Child Life On-Call app for your facility or doctor's office by going to childlifeoncall.com/partners.
My name is Jin Lee. I am a psychologist here in Colorado, and I practice in my private practice since April of 2020. And most of the patients that I see are teens who have chronic illness, and particularly within the area of chronic pain, functional neurological disorder, and post-concussive syndromes.
That's amazing. Well, we're so glad to have you here today to share some of your expertise in working with this patient population. And as a listener of the podcast, we have a lot of parents who come in and kind of courageously and bravely share very intimate details of their own experiences with having kiddos who have an illness or a medical condition. And so I'm just excited to pick your brain today and to have you here and let other parents and professionals kind of learn from you. So I'm going to kind of let you take the stage, and knowing that you focus on chronic pain and functional neurological disorders, just kind of walk us through what you see a lot and how you help patients.
Sure. So basically, I have been practicing in various hospital settings across the years, and I have worked with a lot of children who have chronic illness, and it's sort of like I landed into this particular niche when I worked in the concussion clinic for the past 4 years. And that is where I saw post-concussive syndromes, and then a lot of providers are sending their children away to our clinic for unknown pain syndromes after some injuries, and that's where I started to see a lot of patients that way. And then the pandemic happened, and I was sort of pushed into doing this practice in my private sector, and which has been kind of nerve-wracking, but I really enjoy working with that patients. So most of the patients that I see are high achieving, really good teens who are suffering and struggling a lot. And some are for months, and then some are for years. And I just see parents just wanting to help their kids get better, but visiting different doctors, one after another, and just really not knowing what to do and how to help. And which is pretty common, because about nearly 80% of the parents who have children with chronic pain and chronic conditions, they don't know what to do. And rightfully so, because they're not trained in that area. And same with teens. They have no clue what's going on. Because most of the symptoms are invisible, they are suffering because they feel like they're doing this alone and no one can understand.
Mm.
And I really resonate that with them because personally, I grew up with, chronic knee pain. And, back in the day, it was like, you just take a, Advil and just go on with the day. And nobody really understood what was going on, and myself included. And sort of I forgot about that. And I kind of circled back to this patient population and feeling, wow, okay, what I am hearing from these patients really resonate with the experience I had as a teen in high school. So I really love working with that population.
Oh, wow. Yeah. And the point you brought up about it being invisible is so
Yeah,
important because you just never know what someone else is experiencing or what they're going through or even the degree of pain that they're in. If they're living with it, they
absolutely.
probably have a very high pain tolerance, from day to
Exactly.
day. So how do you support these patients and what tactics and support do you offer?
Yeah, so I tend to focus on the forefront, heavy education. In my mind, education is and knowledge is a power. And so, one of the first things that I ask my patients and their families is, do you know what pain is? Like, what is your understanding of chronic pain? And nearly everyone says, I have no clue.
Hmm.
So, that's pretty much where I start with. And so, most of the patients are coming from specialists and other providers. And, I'm sure they're explaining a lot of things, but you know how these appointments go. Nearly 10% of the information is only retained, right, after
Mm.
each visit. So I am there to be sort of conduit between the families and then doctors coming from the hospital setting working experience. So I start with the education and then how chronic pain becomes chronic pain and how functional neurological disorder evolves to be as such. And I talk about different risk factors and what are the influencing factors that can sort of accumulate to get to the point of what we're seeing on the surface. And that could be, individuals' biological component, family history. It could be psychological issues prior to having these conditions, and it could be social issues. What's going in the family setting? What's going in the peers? Are there any learning struggles? And so forth. So, are there any high expectations that are exceeding one's capability, but not knowing how to stop? And so all of these things are impacting that chronic pain and then all the other symptoms. And so I start from there, and then I draw a map of brain and how brain functions when they are getting different senses from the body, and how the brain is interpreting that experience as either pain or something else. And so I really spend a lot of time on getting that education straight and then talking about how psychologists can help these families, because many people think that, well, why do I need to see a psychologist for my pain? And so that's usually sort of like debunking the myth of how we can be helpful. And so talking about the biopsychosocial models and kind of all the other things are connected. And I always talk about, there are two different stages of the treatment. The first stage is to really focus on the symptom management. So whether it's a chronic pain or the non-epileptic, seizures or tremors or what have you, we are going to take care of these symptoms. And then the goal is to improve and increase the daily functioning. So these patients do feel like that they're quote unquote normal. And I don't even know what normal means these days, but
Mm.
they're increasing the daily function, whether to go to school full time, hanging out with friends, and going back to sports, and just enjoying life, and then feeling like normal. So the chronic pain or the condition isn't the center of the conversation at the dinner table.
Oh gosh, I'm sure that's such a relief. Like when you kind of set that stage about like, here's where I want to get you. Like I can just imagine that a bunch of teens and their parents are just like, yes, I want to get back to being able to live my life without this having to interfere in
Mm-hmm.
every single part.
Right, absolutely. Yeah. And I also make a distinction that I am not here to fix your problems for you per se, but I am teaching you to become a problem solver for your life, for yourself. So that these kids are coming with tips and tools under their belt that they can use for as long as they want, if not the rest of their life. So then they feel more confident and competent in their ability to take care of themselves, because that has been lost along the way while they were experiencing these chronic conditions. So,
absolutely.
Yeah, it's been really. Mm-hmm.
We'll be right back. We are sponsored by Magic Mind. I am such a coffee person. I enjoy the taste and the smell in my morning routine. But the truth is, I go beyond that 1 cup of Morning Joe, and my 2 to 3 day cup habit is expensive and not that effective in the long run. Thankfully, Magic Mind has come into my life. It's a small green shot-sized drink of all natural ingredients like adaptogens to decrease stress, nootropics to boost blood flow and cognition, and unlike regular energy drinks, Magic Mind has minimal caffeine, all of which comes from matcha. After a few days in a row of drinking Magic Mind, I notice I have less brain fog and feel more productive without an afternoon slump. You can try it and get 20% off Magic Mind by going to magicmind.co/childlife and using code CHILDLIFE. If you are looking for a way to make a child in your life smile, then you have to go to smilemakers.com and go through all of the must-have toys, stickers, and prizes for kids. You'll find everything you need to make the hospital, waiting room, or even your own living room more fun with games, crafts, and prizes for every occasion. I also have very good news for you, because when you go to smilemakers.com and type in OnCall20, you will get 20% off with no minimum order required. So stock up on bundles made specifically for hospital procedures and therapeutic play, and make these already very affordable items more affordable with OnCall20. That's smilemakers.com and OnCall20 for 20% off your entire order. Can you picture or tell us about a story or experience where you kind of, without revealing any information about the patient, but just kind of how you've seen a patient or a family evolve through your process?
Absolutely, yeah. So I had a patient, and I spoke with this patient to get the approval to share his story.
Oh, wonderful.
So I recently met with this young man in early 20s, and I'm disguising the information to, protect his privacy information. So about a year ago, he actually got a COVID, and then got better in a month or so. And then he developed myocarditis, and then on to ulcerative colitis. So that became a huge, huge issue, because previously he was very healthy, active, socially, everything was going great, and just having quote unquote normal life. And then on to bam, one day, everything got flipped. And now he has been in the hospital for months at a time and lost nearly 40 pounds of weight, and just getting sick. And he was having really difficult time with the chronic pain, the bleeding, and just this GI issue was really getting to him. And because of the myocarditis, he couldn't exercise for prolonged time. So he was losing muscles, and he was missing just being outdoor and having just fun with his family and friends. So I started working with him shortly after he got discharged from the hospital the last time. And he was pretty much bedridden at home, and he had to take a time off from college and just, staying at his parents' house, and which has a lot of meaning for him as well, wanting to be independent, but kind of stripped them away from him. So there's a lot going on. So I started working with him, and he inspires me in so many different ways. Just moving fast forward, a few months, he's gone through a lot, but medically he is, kind of going through ups and downs, but he is the kind of guy who just keeps going, and he will never give up. And so I asked him, aside from all the tools and tips that we have been talking about, that you have been practicing like every day, like a gospel, which is amazing. And so I asked him, so what keeps you going? Because it's just so amazing. And he said, one thing that made him different was to maintain the hope.
Mm.
And yeah.
Oh, sorry,
Yeah.
I didn't mean to interrupt.
No. Yeah. So he said, even if there are things not going the way he wants, he has never lost hope. So maybe next week he can get better. Maybe next month I can get back to mountain biking. Maybe, next year I can go out fishing. So those are the hopes that he has kept up the entire time. And then we talked about different values in his life. What matters? What are some of the things that he can control and cannot control? So we can sort things out. But he just took on to the whole another level. And that was just so inspiring and encouraging to the point, can I share this with everybody? So that for other patients that are out there feeling like their hope is lost, that is their choice. And that is something that he said, no one can take that away from him.
Oh my gosh, that is incredibly inspiring. It's like
I know.
that mix of just that perseverance, like to not give up, but maintain hope. It's not easy to do, right? Because I feel like if we were all able to do it at his capacity, this world would just be insane.
I know.
But it is very
Exactly.
something to achieve for, or to work for, when you see it make such a difference.
Yeah. So we spend a lot of time on, having ups and downs. And then one thing that I am mindful of is to encourage these patients to give themselves permission to have a bad day. Not everyone has to be positive all the time. That's weird, right? So, but they have this impression that they have to be strong all the time and be a hero. And I'm like, you know what? That's all good if that works for you. But the reality is we all have good days and bad days, regardless of the chronic medical conditions. So absolutely give yourself a permission to have a bad day, knowing you can always come back. You can always come back to deal with your illness, your conditions, your struggles, and what have you. I am here for you, but you are allowing yourself, and then give yourself a permission. And it seems to relieve a lot of patients when I say that, because they are saying usually, can I do that?
Yeah, absolutely.
Right.
And can I admit it, right?
Exactly. Absolutely.
Well, we have a lot of parents that listen to this podcast, and as you said, so many parents just want to help. And what are, for the sake of time, what are one or two things you see parents do that truly make a difference in helping their child succeed through something like this?
Yes. So I'm focusing on the main patient population that I work with, which is teens, which is a little bit different than younger children who need a lot more hands-on help. So I'm just focusing on that, realm. And so one of the things the parents do is they want to help. Sometimes it helps. Sometimes accidentally not helping. And again, this is not to judge, because we don't know right or wrong. So it's not about good or bad. It's all about how can we help. So I noticed when parents are constantly asking their teen, how's your pain? How's your sleep? How are you doing? And what's your pain level? And did you take this medicine? Did you take that? It can be not helpful for two reasons. And I say that. First, as soon as the parents are asking that question, then who is managing that condition, right? So again, it's all about having the ownership. So I am more of a mind of having teens have their own voice and their ownership. So as soon as they start to monitor their own conditions, including pain level and just general well-being and daily functioning, they do so much better because they feel like they are in control better. So I encourage parents to resist the temptation to ask those status checks. So let them come to you because they're going to come to you when they need help from you. And so sometimes just being that support system and the safety net is more than they can do. It doesn't feel much, but that is what helps the teens a lot.
Oh,
And
I love that. It's like by doing nothing and being there is actually doing something, because it can feel unproductive as a parent. Like, I should be asking, I should know what's going on, but it's counterintuitive to how you raised them at the beginning of your parenting experience.
Exactly.
But what you're saying is like just being present and available is doing something.
Absolutely. Yeah. And then the second thing, that's accidentally not helping is then that becomes the center of the attention and then focus of the conversation, right? And then that doesn't have to be that way. And, that the pain level goes up when we continue to focus on how horrible it is. So again, sort of moving away from that attention helps the teens cope better with their pain. And so for those two reasons, I always encourage parents to sort of back off and then be that person to be a safety net so they can come to you. And when they do, they can always punt it back to the teens. Okay, so what kind of strategies are you using to help yourself, instead of parents themselves feel like they have to fix the problem for their child. So again, going back to the ownership and autonomy, that is the best thing the parents can do sometimes, and many times.
Yeah, that's fabulous advice, and always good to hear. And sometimes we have to hear that a lot as parents.
I know. Yeah. Myself included.
Yes. So much easier to teach others than to practice ourselves, right?
Absolutely. Yeah. That's why it's about effort, right? It's not about the perfection.
Totally. Well, I, you and I have had the opportunity to talk before, so I know that you're available to see patients outside of Colorado. So how can people get in touch with you and follow along with you?
Absolutely. So I do have my own website that has a lot more information about chronic pain, how they can get in touch with me. Then my website address is yourpediatricpsychologist.com, and it's long, but you can also find me through Doc Jin Lee. So it's DOCJINLEE.com, and then it'll jump to my practice website.
Perfect. Well, thank you so much for being here today. And I really appreciate all the advice that you gave in such a short amount of time, but it was a lot of information. So thank you.
Absolutely. My pleasure. Thank you.
Thank you. Thank you for listening to the Child Life On Call podcast. I'm your host, Katie Taylor, and you can follow us at Child Life On Call on Facebook, Twitter, and Instagram. Please rate and review to make it easier for other families to find us. We have cute merch available at www.bonfire.com/store/childlifeoncall, and you can listen to more episodes and find resources at childlifepodcast.com.